Let me add my welcome to all of you. For those who don't know me, I'm Dr. Rick Foster with the South Carolina Hospital Association. And I will tell you, it's very humbling and awe-inspiring to look out on all of you and this audience that's here today on the fourth year of our Patient Safety Symposium. It's just amazing what all of us and what you have accomplished as leaders in our state in improving health care. And I think we've been on this transformational journey and we have so much farther to go. Before we get into the program, I have to mention there was a comment about the fact that the Star Wars opening must have been my thought, and I want to give credit to Margie Boland, our communications person, although there was one part of it that we nixed very quickly, and that's where she wanted me to come out in the Darth Vader uniform. And I said, I want to be Obi-Wan Kenobi. I want the robe and the lightsaber. So we decided just to go with the music. So it's wonderful to be here with you. I want to tell you a little bit more about myself. I have lived in South Carolina my entire life, and I've been very fortunate to have grown up in a very small community, Prosperity. I'm very fortunate that my mother, who is here today, with many other people, have shaped who I am and the way I approach issues and concerns and the way I'm able to, hopefully, as you see it, work well with others to create change. And I've just entered my 31st year as a physician working in the South Carolina healthcare system. And I can honestly say to all of you, standing here right now, this is my proudest moment as a physician and healthcare professional in the state, to realize how much we have accomplished together and how far we have come on this journey, but also to have a chance to reflect on the fact that we have so much further to go together as we work to transform not just the healthcare, but the health in our state, and doing it from community to community. When I joined the South Carolina Hospital Association in this role 4 years ago, I realized very early on that this was an opportunity to enter the mission phase of my career and to treat what I was doing as basically from a mission standpoint to transform health and health care. And it's been driven by three very important people in my life. The first is my wife, Lisa, and the other two are my grandchildren, Nico and Lucas. And let me assure you, 4- and 5-year-old children can re-energize you on a daily basis or overwhelm you. The joy and the enthusiasm for life, even at sometimes 1 o'clock in the morning, is an amazing thing. And I want to start with my wife. For over 20 years, she has gallantly and courageously battled against a devastating and evil disease called multiple sclerosis. And I look to her as kind of as a hero because I complain when I get just a twinge of pain someplace, and she constantly deals with pain and numbness and limiting ability for mobility. And what I've realized as I've watched her fight and her touching within the healthcare system is that while she'll never be able to return fully to full physical health, she'll always be challenged with the physical health. Her emotional and mental health could be much better if we could find a better healthcare system to work with her. The system is so fragmented that it creates a great deal of challenge for her. There's no one really that has been identified as coordinating her care other than doing the best she can and what I can do to help. She's on multiple medications, both for the multiple sclerosis as well as medications to treat the condition she's gotten from the treatment for her multiple sclerosis. And yet she continues to fight that fight. And what I hope for is that we'll reach a day when she and many others that have these types of chronic illnesses, sometimes no matter what they did or didn't do, will be in a system where the care is coordinated and we can actually work to improve the quality of life. And I'm certain that everyone in this room has someone that you know. It may be yourself, it may be a family member, it may be a neighbor or a fellow church member or someone you've treated that is facing the devastating effects from a chronic illness or some other major health challenge where every day you say, we could be doing better. We could be doing better for them and for their families. And we're very fortunate that my wife has a good family support system, and when she has very good doctors and other healthcare professionals, it just could be better. And then for my two grandchildren, Nico and Lucas, they're very fortunate that their mother, my daughter, works for an employer where she does have healthcare coverage. And they do have access to a primary care home. And they are able to go to good schools. But that could change in an instant. Her job could go away, and she would no longer have coverage for them and be challenged with whether they'd be eligible to go in the Medicaid system, what would happen? And they have friends, other children, who don't have that benefit and don't have the access to care and to coverage and miss school on a regular basis because they may be in the emergency room with an asthma attack. And it makes me think that it can be better. And I want them to grow up in a world where our health is better in this state, and they know that the health system will be there to support them. And we do face many challenges in our state. We're faced with major economic crises, and we have major problems with health status and health disparities. It's unacceptable that we have communities where there's a fourfold difference between African Americans and whites as far as the number of ED visits and hospitalizations for asthma. It does not have to be that way. We can do better. And where I have hope, and it's based on all the work that all of you and others that are not in this room today have been doing, is that coming together in a sense of collaboration and collegiality, that we actually can change the system. And we've already seen evidence of that. And I will tell you, when I came to the Hospital Association 4 years ago, if someone had walked up to me and said, in 4 years from this time, we will have a heart attack care system that's one of the best in the country, and that we have reduced the time from door to balloon by over 30 minutes across the entire state, and we're improving not just the mortality rate for heart attack patients, but the quality of life, so they're actually able to play with their grandchildren like my grandchildren, I'd say, that's a wonderful dream, and let me offer you some medications that will help with that problem. And if they had told me that we would have already statewide reduced the infection rates in our hospitals by over 30%, or that we would be the first state to fully commit to using the surgical safety checklist and a team approach to surgical care in every operating room for every surgical patient, I'd say you definitely need more medication. But those have already been accomplished. And it would not have happened if we had not been willing to come together in a spirit of collaboration and a can-do attitude to say we can make a difference. So there is hope that we can do much better to create a healthy South Carolina. And what we're talking about is not only improving the care experience for each patient, we still have some room to go on that journey, but actually each of you, as not just leaders in your hospitals or organizations you represent, but hopefully leaders in your communities, to create what would be healthy communities, healthy at all levels, where people feel safe to be out on the streets, where they feel like that they know that they'll have access to a primary care home. That when they come in the health system, not only do they get good care at that point, but there'll be someone or groups of professionals working together to coordinate the care across the care continuum. So now it's time for us to work together to build that and to create the triple aim in a way that actually happens, community by community. So over the next several years, we can all come back into this room and say, we've actually not just improved health care, but we're producing good health. And we're creating a healthy South Carolina. So as we move forward today in this session, you're going to get a chance to hear about what I would say is a different approach in health care to making this happen. Building on the collaborative work we're already doing is how do we come together truly across all sectors of the community for the individuals and organizations coming together for a common cause. And in this case, our cause is to create healthy communities and produce health across our entire state. And using the organizing model, and you're going to hear more about that during the course of this session this morning. And I think it's a wonderful way for us to really make that difference, community by community. But I want to finish up with my part of the story by taking back to December of 2009. I had the opportunity to go to the IHI National Forum, and along with over 6,000 other people, walked into the conference room that's probably about 15 times the size of this room. So over 6,000 people for one of the keynote presentations. And I noticed on the schedule there was this gentleman named Dr. Marshall Gans, and I'll be very honest with you, I did not know who he was. I just knew that he was one of the speakers that Don and Maureen had chosen to come and speak, and they've done a wonderful job of bringing speakers from other industries and other perspectives. And within the first few minutes of his presentation, talking about his story and how we could use the organizing model to create real change in health and healthcare, I found myself on the edge of the seat. It was hard for me to stay in the seat. And I thought about the fact that this is the mentor I never knew I had. And I also realized that a lot of the work we were already doing to improve heart attack care and prevent infections and make surgical care safer was a form of organizing, but there was a way for us to take that to the next level. So that has been a wonderful impetus for us to try to look at how we go beyond just looking at healthcare, but looking at health. And we've had this wonderful opportunity, based on the work that Marshall and Kate and Terry and others have done with the Organizing for Health program, to be one of 2 lead states in making this happen. So as we move through the rest of the program this morning, it's my pleasure to introduce Dr. Marshall Gans. Unfortunately, he couldn't be with us in person. My understanding he's over in the Middle East, trying to help them with a few social and societal problems they have there. We had a talk the other day, and I said, it may not be that much worse over there than it is here in some cases, but we understand why you need to be there. But he's going to be joining us by video now, and I hope you will have an appreciation for the power of his story and how this model for change, this organizing model for change, can allow us to truly create a healthy South Carolina for everyone, not just my wife and my 2 grandchildren, but everybody else you know that can have a healthier life. So now, Dr. Marshall Gans.